Welcome to the Dental Implant Practices podcast, where each episode will explore how to integrate dental implants into your practice and into bone, with your host, Dr. Philip Gordon.
Welcome to another episode of the Dental Implant Practices podcast. I'm your host, Philip Gordon, and today I have the tremendous honor to introduce a special guest, Dr. Scott Leune. Now, Dr. Leune, you graduated from the UT Health Sciences Center School in Dentistry in 2005. Is that correct?
Yeah, that's correct. I've been out for 11 years, some school here in San Antonio, Texas.
Okay. Tell me a little about how, after you graduated dental school, bring anyone who doesn't know your story up to speed about how you practiced and what brought you to the point of, being the owner and CEO of Breakaway Practices.
Yeah, I got out of school and I built a startup practice right out of school, and the numbers that we hit were pretty incredible. I never expected that. We were seeing about 350 new patients a month, seeing mostly PPO patients and some fee-for-service patients, no Medicaid or HMOs. And going through that process of building a high-growth startup practice, where we're seeing 350 new patients a month, just a lot of things went wrong. A lot of things broke down. How do you schedule that many? How do you provide great clinical care? I mean, these are all kind of questions that I had to wrestle with. And I added a second dentist, a third, and a fourth dentist. And I eventually opened two more practices. And within 3 or 4 years after graduating, I had 3 locations and 10 dentists, and I sold them all to Heartland, because I had actually had a medical problem. I broke 2 bones in my back, and so I decided to sell the practices. And through that process, I learned a lot of lessons about how to do more specialty procedures, how to manage people, how to market better, how to continue to drive new patient flow up, how to just have great business systems. That led me to then become an entrepreneur. And as an entrepreneur dentist, I built 7 more practices, 5.5 hours away from where I lived, and sold those as well, a handful of years later. And this whole process of building and managing, owning the success, the failure, learning how to handle phones properly, and billing and insurance and marketing and patient flow and specialty procedures, all these things I had to do extremely well, or when I did them poorly, I had to recover extremely fast. And that led to the lessons and the systems, just the core principles of how we do these things. That led to us expanding Breakaway Practice. And Breakaway Practice is a company that started out as just giving seminars, teaching dentists how to do some of the things we did to drive up patient flow and to be more successful. Breakaway Practice since then has completely transitioned to something much bigger and greater, more important. We now help over 300 practices across the country manage their business in some way, by either scheduling their patients or cleaning up their billing and insurance or verifying appointments for them or doing their marketing or IT. We do a lot of things. We've also helped build 80 startup practices using these same systems, and those 80 startups are triple the size of the national average. So we've been very proud about how those practices have gone. And we've expanded the types of seminars that we give to any dentist that just wants to learn all the things that we live by. And in those seminars, we'll give them hundreds of pages in a manual and tell them 100 answers right there up front. No rah-rah, just straight content. And they get to go home and decide how much of that they want to do on their own.
I can speak from my experience. I've been to your advanced startup and your business master's class, and I can tell you I'm pulling my manual and looking at those almost weekly for something will happen in my practice. And I think, I got to do this better. I know Scott talked about it in his manual, and this is the week that we're tackling X problem, and so I can say absolutely those manuals and courses are fantastic. So Really want to thank you for the information you provide there.
Yeah, thank you.
Now, I think you said some interesting things there from a business standpoint. You talked about, PPO and some fee for service. The more I listen and the more I practice in Kansas City, the more I see going on, PPO is more and more dominating the field, and fee for service seems to be decreasing less. Even in patients that have money, I feel like they're being more and more insurance minded. Do you see that continuing, and how do you see that shaping how dental offices have to become better business minded?
Yeah, well, I know myself and others like to speak negatively about PPOs. There's also the positive side that we have to consider, that patients that have a dental insurance plan, like a PPO plan, they see dentists much more frequently than those that don't have insurance. And because of it, dental insurance is as evil as some of those companies are, in my opinion, and as a pain they are to deal with, there are obviously the benefits of having them. And, when the tide's coming in, we can't necessarily shift that tide. What we have to figure out is how do we take advantage of the tide coming in? How do we react to it properly? And the tide is that healthcare is going through a large change. Medical costs are getting out of hand. The government is stepping up their kind of control over medicine. Employers are having to shoulder the burden of healthcare costs more and more, which is resulting in many employers having less and less robust dental PPO plans for their employees. And it's slowly changing the face of what it's like to be a dentist. Of course, there's also a whole lot of other things changing, like corporate dentistry and things like that. But in regards to PPO plans, what's important for us in our practices is that we first build a practice that becomes successful financially and successful clinically. And once we start getting full in our practice, full in our schedule, we then decide, should we expand more? Should we open more days, more ops, more dentists, more hygienists? And at some point, we don't want to expand anymore. And at that point, we start shifting away from some of these PPO plans, because if our schedule is full, that means we don't have enough room for everyone. So let's just see those that have maybe the better plans or that don't have a PPO plan. We also make shifts in how we market. We make shifts in what type of specialty procedures we go learn how to do and implement. So, when I look at the insurance side, I see it as one of the many moving parts of dentistry. And how we use that moving part, how we respond to changes, has mostly to do with our ability to maintain a full practice. If our practice is full, we can move a lot more freely and in a more profitable way, compared to if our schedule is wide open and we're desperate for patients. It's much more difficult at that moment to drop Delta, for example. This evil insurance part of our industry, which of course, I'm being dramatic. I don't necessarily feel like it's all evil, but the insurance side that we look negatively on is really more of a trend of trying to make dentistry more affordable. And it might be that in the heyday of dentistry 10 years ago, when patients were watching Extreme Makeover and asking us to just do veneers and Zoom, it might be that heyday allowed us to charge a lot of money for what we do. And it seems like there's kind of a shift. Maybe it's a correction, maybe not, but it seems like there's a shift that says, okay, dentist, $1,200 for a crown is a little much. You need to learn how to do it for $800. And that shift being driven many ways by insurance companies and reimbursement rates, that shift is forcing us as an industry to become better business managers. I make the comparison. I compare dentistry to restaurants. If we were to go build a restaurant right now and run it like we run a dental practice, we'd go bankrupt. And restaurants have been really forced to have great business practices by capitalism. And dentistry is starting to feel that a little bit. We've always had a monopoly. We have to be a dentist to own a practice in essence. And that's starting to change, and we're starting to feel the pressures of the industry, and it really is forcing us to run better business systems. So we could sit on the sidelines and cry about it and see our profit margins go down and see competitive forces kind of push us into, a lower level of success. Or we can see the tide coming in and learn how to adapt to it and maybe use this as the opportunity to finally perfect how we run our business. What we probably know deep down inside we should have been doing all along. Well, now maybe this is the time to start doing it.
Yeah, I agree. There's definitely been a shift in the market, and that shift isn't done yet. So who knows where that shift is going to settle, but there's a lot going on. You touched on a couple points I want to bring back to here. You talked about the heyday of cosmetic dentistry, and I would agree with you. I think that heyday is over, and patients are much more selective on how and when they do cosmetic dentistry. But one thing I do believe strongly and have experienced in my practice is I think the heyday of implant dentistry is just getting started. So do you see any trends or have any experience in implant dentistry moving forward that you're noticing that's where the future of dentistry is headed? And if so, how do you think about getting general dentists on board with that?
Well, I'm in a very lucky spot in that I get to look at and analyze practices all over the country every day. And when we look at the startup practices that we've helped build, for example, in one of our consulting programs, the highest performing startups in our group nationwide all do implants, and they're all general dentists. And implants, especially in the last handful of years, have become much more predictable to learn and implement. And if you combine that with guided surgeries, now all of a sudden, the risks have been more mitigated. The learning curve is even smaller. And so it's a prime time for a general dentist to look into implants, to learn how to do them, and to add that to their kind of menu of procedures in their practice. Implants themselves, if we look at the business side, what we know is that when we refer patients out, there's a loss, a drop-off that happens of patients actually getting the work done compared to if we do it in-house. We also know that with implants, the nature of the procedure is relatively easy on the schedule. In other words, doing an implant doesn't take, placing 2 implants doesn't take near as much time as doing 2 molar endos for most dentists. So we've got kind of this high dollar procedure that we can do in-house that does not take a lot of the doctor's time. And for a patient, it's the most, of course, the most conservative thing we can do with a high rate of success. And insurance companies are slowly being more friendly to implants. And so when I kind of look at the big picture, what I see the main driver, I guess, of implant success and growth in our industry being today is the dentist's ability to learn to do it and to properly communicate it. It's not like it used to be decades ago where we were worried about the success rates. And it's not like it used to be even 10 years ago where a general dentist could only do just the very easy cases and, don't touch an anterior tooth. Today, the technology and the track record is there. And so now it's all about just a general dentist having the confidence to move forward and learning how to do this simple procedure. In many ways, it's simple. And of course, then combining that with the know-how of maybe marketing this properly and discussing it with patients properly and knowing how to set up financial arrangements with patients properly.
Yeah, I agree with everything you said there. I can place about 4 implants in about the time I can do 1 molar endo, and it's usually about half the stress. So I love placing implants, and I think when you talked about managing specialty procedures in the general dentist office, for me that one's a no-brainer. And I have found that as far as reimbursements, insurances, if they pay, generally pay very well on implants. So some of the major struggles that you talked about are marketing, communication, financials, and then just the confidence for general dentist. And the confidence really comes from lack of training, or the lack of confidence comes from the fear of not having proper training. And that's kind of what I'm hoping to help break through with this podcast is where do people go for that training? And do you know of any training seminars that you have recommended to any of your affiliates or any colleagues, or have you heard about anyone who's really got a top-notch course for a general dentist?
I don't know much about everyone's courses, but I do know about the courses that we have hosted. So at Breakaway, we have all these business seminars, and that's what we're known for. But we also host clinical seminars for our dentists. For example, we've got an 18-month orthodontic continuum in 2017, starting early 2017, to learn comprehensive ortho. On that same note, we've had a couple of implant courses as well that we've hosted. And the company we've worked with to host those has been Implant Direct and their team of speakers. And Implant Direct also has, I believe, in Arizona, or maybe it's in Vegas, they've got kind of a corporate CE headquarters where they constantly are giving courses. So I don't have experience with the other groups out there, and I know some of them are just very well known. The only experience I have is with dealing with Implant Direct, and their team has been excellent to work with, and the quality has been high on the course side.
Yeah, that's interesting you say that. I actually had some of my Implant Direct reps in my office the other day, and they're based out of Las Vegas where they do all their training. I definitely think they are more geared towards the general dentist as far as their approach. I was curious, something I was going to ask you, would you be, are you looking to implement more training for CE into Breakaway's programs? And is that only limited to people that are affiliates, or could someone who has, just use your services, could they sign up for those seminars? What's your plan for more CE, and who can take some of those classes?
Well, our CE is, we develop the clinical CE with the main purpose of bringing value to our startup doctors that we help in our consulting program. What you mentioned, our affiliates.
Sure.
However, every CE course we do, we're only going to, we're going to have some open seats. About a third of our seats are open, and we offer those open seats to dentists outside of our consulting program. So this orthodontic continuum, for example, you learn short-term ortho and comprehensive ortho in a very deep setting over 18 months, and we will likely have about 30 available seats for that continuum for doctors that aren't necessarily connected to our company.
Great. That's amazing, because I know, like I said, I joined on the bandwagon too late and didn't realize when I expanded my satellite practice that you were an option, but I've kind of piecemealed everything together. But now that I'm looking to open more startups in the future, I will definitely consider your startup pathway, as I know, having working in 2 offices right now, having 3 and 4 and 5 seems daunting, and I don't want to go that course alone. But definitely love the guidance that you teach with that.
Well, if I could, just for a minute here, I think a lot of general dentists picture themselves having a high quality practice that they live close to. And over time, they'll learn how to do a few more extra procedures. And they hope over time to be able to drop some insurance plans. And then when they're 65, they hope to retire.
Mm-hmm.
And there's nothing wrong with that path at all. That's one path. But I think that there's a misconception that some dentists have about owning a group of practices. The misconception I see is that owning a group means bad quality dentistry. It means hectic life and work balance. It means, a lot of headaches and struggles and risks. And yes, all of that does happen for those doctors that aren't doing it the proper way. But if we think about this conversation about implants, the most money I ever made and the best lifestyle and family life I ever had and the least amount of risk I ever felt was when I had a couple of practices and I worked 1 day a week in those practices doing specialty procedures. That is a sweet spot where, for example, if you had 3 practices and the practices could hold their own without you, and now you're just there 1 day a week placing implants, that means you're placing implants across 3 patient bases. So you are highly productive. And that means you're doing what you love to do all day long. And when you want to take a 2-week vacation, you don't think twice. You just go do it because the practices are holding their own without you. That was a beautiful setup for me. We did high quality work. I had a great family life and balance, and I made a lot of money. It was like the best of everything, and it was almost too good to be true, but it was true. It was awesome.
Sure. And, that's the model that I'm trying to gear towards. And I think there's a group of dentists that can see themselves doing that. And I commend you on your end. That's where your group comes in and says, I can help take you from, 0 to however many you want. You've got a recipe for that that's proven. And so I think that's fantastic. But like you're saying, that would give somebody the ability to say, I want to be an implant specialist within my 3 practices. And if that's all I want to do, then you can do that.
That's right.
Yeah. Obviously, you've seen a lot of practices start up. What's your recommendation on CBCT if someone was placing a lot of implants? Do you see implant imaging centers pop up a lot across the country, or do you think owning your own cone beam is appropriate when the finances support that?
Yeah, the cone beams have come down in price so much, and they will continue to come down in price. I can't even get a manufacturer to commit to a set price because they know their prices are changing every 6 months. So, the prices are coming down and down, and where the prices are today, especially when you consider the fact that we're probably financing the cone beam.
Sure.
The cost is not a burden anymore. It's not a barrier to entry because we're paying, if we could cover that cost very quickly with a very small volume of implants. So, I don't have a particular recommendation. I'm the wrong person to ask on what piece of equipment to purchase. But I will tell you in general, we are seeing this equipment go into the practice and not referring patients to an imaging center. The only times that we now are seeing kind of that game being played is when a dentist has, multiple practices within a short amount of time from each other, a small radius. They might have one expensive piece of equipment in one practice and they share it amongst 3 locations. That's the only time I've really seen that. The trend now is you have your own. And the trend also is dentists are learning to do a lot of specialty procedures, not just implants. And that cone beam or that expensive piece of equipment is needed for or would be beneficial for other procedures. And I think that's really the trend that I see in dentistry. As our fees go down, as corporate competition gets harder, and as all of our costs go up, there's more and more pressure to expand the menu of services we provide, to keep more in-house. So this isn't just about doing implants. It's about doing ortho. It's about doing sleep apnea therapy. It's about doing gingival surgeries. We as dentists have to understand that the business side of our industry is putting pressures on us, and we can solve a lot of those problems by keeping more in-house. A dentist that is truly honest with themselves and with the trends in the industry will likely commit to continuing to learn additional procedures. Implants is at the top of my list.
Sure. Yeah, no, I completely agree. It was my study and duty to train myself through continuing education as many expanded procedures as I could upon graduating, and endo, extractions, short-term orthodontics, and now implants has been on those lists. And I agree, those CBCT, those cone beams are almost invaluable to root canals and orthodontics nowadays, to where you can have proper case selection and increase the speed and productivity of the case. When I place implants now with a cone beam and a drill guide, my average time on a single unit might be 30 minutes. And if I was doing that freehand, it might be 2 hours. So the technology has definitely increased our work speed, which saves us time and money, which increases the business of dentistry. So I think there's a tight correlation there.
Yeah, and I think the lack of confidence that we all have as dentists about certain procedures comes mainly from a lack of information.
Sure.
The information that it can only take 30 minutes, or the information that, look, it's not hard to drill a hole, right? And maybe we have to go do it on a pig jaw first to see, oh, this isn't that hard. Or if we're the doc that says, I never want to suture anyone, well, we then go do it and learn to do it without suturing. Or if we are suturing, go learn how to do that, right? The lack of confidence is usually just a lack of information. Even the lack of confidence in building a startup practice, for example, is due to the lack of information. If we knew exactly where to put the practice, exactly how to design it, and exactly how to market it, well, then maybe we would have a lot more confidence in doing it. So for those of y'all listening to this podcast thinking, well, I want to do implants or I want to do bigger cases, but you're kind of worried about it. You're worried about starting. I think that worry has a lot to do with just not having the simple information, and going to a course and watching someone do it is what you need to do.
Now, getting off implants a little bit right now, you see a lot of information and talk with a lot of people in dentistry. What are you curious about in dentistry right now as we're heading into fall, and 2017 will be here before we know it? What's at the top of your curiosity list on what lies ahead for dentistry in the next year?
Well, a big thing we've been focused on, we've been focused on several big things, but, we really analyze the nitty-gritty, boring details around how a practice operates. Like, is it faster to verify insurance this way compared to that way, for example? Or if I say this one sentence on the phone, does that change my result? So I believe that there's a lot of people trying to get answers like that. And we're one of them. And of course, that's part of what we do is we answer 30,000 phone calls a month. So it's really important for us to know every little bitty thing we could do that increases success a little more. What I'm seeing right now is a big growth of the corporate side of dentistry. And those little nuggets of information, those valuable things, how to do something slightly better. The corporate side of the industry is taking that and running with it and building practices left and right. And, for 2017, the big thing that I'm curious to see play out is this polarization that we have in our industry, corporate against private doc. Breakaway, we're trying to position ourselves right in the middle of that, meaning we want to take all these corporate benefits and best practices and give them to the private doc. And I'm interested to see how fast that trend, that middle that we are trying to be in, will grow, because medicine never had the middle. No one ever took corporate advantages and gave them to private physicians. And so we end up today now with a small group of boutique physicians and a huge group of HMO-based hospitals. In dentistry, I think we can do it better. I think we can have a middle and slow down kind of this trend that most dentists think is negative. So I guess that's a bad answer to your question. My curiosity is going to be all about 2017. How does our industry evolve and shift based on the corporate trend that we see?
No, I think you're spot on there. The things that I see and notice and listen to, I think you're dead on with those analysis. And I know you do a lot of startups, and that's where you're focused. Have you ever seen, or your company, have you guys helped with startups for specialists, or have you ever seen a implant-focused startup before? Has that concept come across your plate, or is that just a terrible idea?
Yeah, we've helped specialists, and we have helped kind of denture-only practices that, of course, do a bunch of implants. And so I don't necessarily think that's a bad idea. You know, these are all calculated decisions. Are we in the market that could justify that? Do we have the ability to actually do it? Do we know how to market it properly? And can we process the phones right? And can we bill for it correctly, right? These are all things we have to know how to do. In general, though, the trend is that the more seasoned business dentists, they might be new dentists, but they've done a lot of business study on their own. The seasoned kind of entrepreneur dentists are going into the marketplace in the startup situation, marketing that they are a general dentist, but then they are also building these channels of focus around specialty procedures. So if you are an elderly patient of a certain income level within a certain demographic area of Austin, Texas, for example, you might see a marketing message all about implants and think that that's all this practice does, when in reality, this practice does everything. They are just marketing these narrow specialties in a very deliberate way. So now, and you've mentioned several times we deal a lot with startups. That is true. We deal with a lot of startups, and we've helped build a whole lot of them, and we will continue building them for dentists. We're even funding dentists now to build their own startups. But only about a third of the dentists we work with have a practice that's been open less than 5 years. So about 2/3 of the dentists we see and we work with and the practices we help are existing practices or even mature practices. They're not startups.
Do you see that trend continuing more? Do you see more of 2017's business for you in startups or established practices seeking your services?
Yeah, that's a tough question to answer.
Yeah.
You know, we do about 30 different things at Breakaway. And if a practice just touches one of the 30 things we do, they grow on average 24%. So if they were $1 million practice, if they just use us in at least one capacity, they become a $1.24 million practice on average. Well, that increase in success, typically done without a lot of implementation on the practice's part, that increase in success is very valuable to an existing practice. However, a lot of startup dentists come to our company because we are known for being able to build successful startups. So your question was about my company and what's going to be the trend in 2017. I think we will continue the trend, a third startups, two-thirds not. And that represents that is unbalanced compared to the industry. The vast majority of practices, of course, in the industry are not startups.
Sure.
So please don't think, what I don't mean to say is, as a whole, dentistry is going to change to a startup model. It's not. But when you understand how to do a startup and you look at the market and see a bunch of older, dumpy practices and dumpy locations with poor profit and old equipment, it's really tempting to just go build it right from the beginning, especially if you've got a predictable way of getting patient flow. So we are involved with startups in a big way.
Sure, understood. Now, you talked about maybe a general practice having channels of focus, and I think that's a great way to approach it in your thinking and your marketing. For implants, my channel of focus is the baby boomers. That's where I strategically have put my practice, and that's who I try to market to. Where do you see the baby boomers fitting into these trajected marketing channels, and do you think that's a good generation to go after?
Yeah, that's a great question. In general, the numbers say that the baby boomers are the ones we should be marketing to for implants. However, I don't like to operate practices on generalities. So here's an example. I've got a practice outside of San Antonio where we are surrounded by young families, and a lot of them are military. And we've got a younger dentist with a beautiful brand new facility, and that dentist places a lot of implants. And so yes, baby boomers are more likely nationwide to need and want and be able to pay for an implant than someone else. However, if we ignore everyone else, we miss out on a lot of implants. So the way we approach this kind of question, how should we market and how do demographics come into play? We end up doing a whole lot of testing, a whole lot of split testing. So in our marketing department, when we're marketing for practices, if you wanted to do more implants in your area, whether or not you're surrounded by baby boomers, we would go create 3 or 4 different types of marketing campaigns, and we would cross-pollinate all of those across all of the demographics, and we would then listen to the phone calls. We would mark if they showed up to your appointment, and we would ultimately track how much they produced and analyze all the data before we then know what should we say and to whom. And we will even change our recommendations depending on if the practice is desperate for patients and just wanting to bring in as many people as they can, or versus, I guess, the opposite of that, if the practice is already really full and they're just trying to bring in the very select group of best patients. So I don't even think about baby boomers, to be honest with you. I think about, I've got a practice location, and we are going to split test all of our marketing to see who responds in the right way, and then we're going to do that.
Yeah, and in some areas that might be a baby boomer, in some areas it may be a 35-year-old war veteran that just got back from Iraq or Afghanistan that had their teeth knocked out in war. So
that's right. But I mean, of course, you're right. The older you are and the more money you have, the more likely and able you are to need an implant. So, of course, if we are wanting to build an implant-based practice and we're trying to choose between location A and location B, we will consider demographics in our decision. But most of our practices and most of our dentists already have their location. They're already there. They're wanting to learn implants, and now they want to market. And we don't pigeonhole their marketing campaigns to just the baby boomers, because there might be a high enough volume of everyone else that we might get a lot more implants going after them.
Sure. Yeah, that's a great way to do it. Well, we'll plan on closing off here with one last open-ended question. You know, in considering the practice of dentistry, I know you have 1,000 different moving parts and recommendations. What are what would be on the front of your brain your best three practices for someone saying, I need to do better? What are three top tips that you would have for someone wanting to just be a better dentist in 2016?
Holy cow. Okay. Well, I guess the way I'm going to answer this is I'm going to look at what drives success for an existing practice. I think that's how I'm going to view this. So if you're managing the business side in the way that I believe it should be managed, a lot of decisions and a lot of growth will be based on your patient flow, your demand. The more people trying to get in your doors, the quicker you can move, the quicker you can grow, the more you can implement different things, the more implants you can do, for example. So one big important thing is driving more patients to the practice. And the thing that affects that the most is not marketing. It's how we handle the phones. So number one thing of importance that I'm going to list here is how we handle the phones, which means how many calls do we answer? And of the ones we answer, how many patients are scheduled? A typical practice will answer about 2/3 of their phone calls and will then convert 42% of those. So in other words, out of 100 patients calling, they only get 26 patients scheduled. And one reason why our practices grow so much bigger is we are now answering 97%. And as of yesterday, we're converting 86% of those. So where practice A gets 26 new patients out of 100 calls, we get 83. So that's number one, phones. Number two has to do with managing our own ability to be better. The dentist brain. So how we communicate for case acceptance, how we communicate to manage our team and get them to do the right thing every day. Our ability to do the things we know we should be doing, but we're just not making the time to do. Kind of like we know we should be working out every day, right? We know we should kind of eat right every day, yet we don't. Well, we have to have the ability to quit making excuses and quit BSing ourselves and to just go do the right thing. And usually most of us, it requires some sort of either coach or some sort of group, some sort of mastermind group, something giving us the drive and the energy and the, influencing us to do the right thing. So I think number two is about really looking inside of ourselves and cleaning that up a bit, getting better like we know we should be. And then I think the last thing here is taking advantage of the large shifts that are occurring in the industry. So, for example, the practices that we're involved with, they typically shave 1/3 of their supply costs off just by joining our supply procurement system. The shift of insurance. Now, as a group, we can join together and negotiate insurance plans better. As a group, we can learn things better. We can learn from each other better. As a group, we can have a call center handle things for us better. We can market better. I think that it's something that's been missing in dentistry. Private dentists, have not formed their own groups. And of course, I'm describing what my company does, and I'm not trying to do it to shamelessly promote myself, but it's been missing in dentistry. We got the corporate groups doing well. We got the insurance groups controlling us, but the private dentists, we just haven't gotten off our seat and held hands and joined together and form our own powerful way of influencing the industry. And I think that's important. I think we have to carve that out while we still can.
I think those are great tips. Definitely, you've got a lot of insight into those, and I definitely would agree with all three of those, and especially that last one. The entities that tie themselves together moving forward are only going to be stronger in the future, and it's kind of hard to do it all on your own. You've got to have groups and leadership and people with some foresight to take the charge in that. And so I think that's why, I really respect what you're doing for kind of taking that charge for a lot of dentists out there.
Yeah.
Well, I will wrap up with that today because I don't think we're going to top that. But I will close today's podcast here, and what we want to do is provide anyone with any information looking to get a hold of you or interested in your seminars or your services. What's the best way for someone to reach out and say, I'm looking to do better. I know that Scott and his team have got something figured out. What's the best way for someone to get going with joining up with your team?
Well, what's important is just getting information first and figuring out if any of it makes sense for a specific practice, right? So someone listening to this that likes what I said, next step is just get some information because you know what you need, you know what you want. And so the best way to get information is go to our website and then contact us. And, because what we do, there's a lot of things we do, and some of it might make sense and some of it might not. So breakawaypractice.com, breakawaypractice.com. Now, for those dentists that want a kind of boot camp type crash course into advanced practice management, where you sit down and you get a ton of information just given to you and you walk out exhausted and excited at the same time, that's our seminars. And that's a 2-day seminar, and you walk out thinking you just got 2 years worth of information. And there's no rah-rah, there's no storytelling. This isn't a seminar about me or my kids. This is pure content. And that is probably a great way to be exposed to our philosophy of marketing, of managing practices, of growing success, looking at the clinical side as well. It's going to one of those seminars.
Yeah, I agree. I think that's some of the best CE money I've ever spent by far, and I'm already looking forward to the opportunity to go back and take them again. So I want to thank you for your time today and everything you do for the dental industry moving forward, and look forward to seeing and talking with you again soon.
Awesome. Thank you so much for having me. Good luck to everyone in expanding your implant side of the practice. Best of luck with everything.